The situation in India is beyond heartbreaking. WHO is doing everything we can, providing critical equipment and supplies, including thousands of oxygen concentrators, prefabricated mobile field hospitals, and laboratory supplies.
Dr Swati Maheshwari is a senior internal medicine specialist and joins us now live from New Delhi. Swati, the situation is truly appalling. We're hearing that people are dying on the steps of hospitals because they can't get a bed in the hospitals. They're dying because of lack of oxygen, because of lack of drugs. What's your experience been?
Absolutely. We are reeling under the second wave right now. And as you can see, we have been getting the highest number of cases. If you look at the worldwide figures, we have been leading since last 5 days, and not a happy thing to do as well. The sad part is that, yes, the death rate is also kind of going up because of the overwhelming number of patients that we are seeing, and even our healthcare systems at this point of time are completely overburdened, and they are buckling under the pressure, as you can see, because we can't take in more patients now, and the number of patients are increasing day by day and every second over here in India. The government is trying to do their best as such, and we have deployed army as well, and we have roped them in, and we are trying to airlift oxygen cylinders and also various other medical supplies from different parts of India to get them to the place where they are needed most. And we are thankful to our allies as well, who have come forward and helping us in the time of the need. As you can see, US, Britain, Germany, many countries have stepped in, and they are trying to help India out of the critical situation. Of course, we need much more than what has been offered now, but we are happy that things are being offered to us, and we are also trying to channelize all our efforts that we can right now and all our resources as much as we can. We are trying to create more and more of such makeshift hospitals, as you're seeing right now on the screen, as much as we can, so that we can accommodate more and more people and sick people around. And also, again, like Italy and Spain and everywhere, we are trying to triage the patients and see as much as we can manage at home and take the critically ill one into the hospitals. But the major pressure that we have right now is of oxygen shortage, and especially because of the transportation issues that we have across India right now. But we are trying to deal with it as best as we can.
It must be extremely exhausting for doctors like yourself and extremely scary for ordinary people who are trying to get treatment. Is there any sign that the government's lockdown is having an impact on COVID numbers, or is it too soon to tell?
Yeah, we haven't gone for a complete lockdown right now per se, as such, I would say, except few cities which are under lockdown right now. But what we are trying to do is this time is weekend lockdowns and some night curfews. So, so as to dissuade people from coming out, to help them understand that we are undergoing critical situation and they need to move out as less as they can so that we can break the chain. But we never know where we are heading for, because if the numbers keep on steeply rising, then we might head towards a lockdown as well, because that might be the last desperate step that we might have to take. A harsh
well, don't you think India is in a position where it has to take that step? I mean, it is in a desperate situation.
It is in a desperate situation, and right now the countries and the governments are trying to manage their best and see if they can find a middle path where the livelihood of the people is not affected too much, and yet we can cater to the medical needs of the people right now. So we are trying to find the best way possible right now, though some of the cities have already undergone a lockdown. But what we are looking at is not a countrywide lockdown, but we're looking at lockdowns where we have hotspots and micro-containment zones, so that we could break the chain and, relieve the pressure on the healthcare systems right now. But we are trying to find a middle path right now and not going for a complete lockdown. But God forbid, if the numbers continue to rise, then we might land into a lockdown as well.
Dr Swati Maheshwari, thank you very much indeed.